Hey guys, Dr. Nicholas Howland here, board certified plastic surgeon, and I'm a very busy surgeon, which is why my desk looks like this all the time. All right guys, have you ever seen a trend on social media in plastic surgery that you immediately think, ooh, that is not gonna age well? Today we're gonna talk about some trends that I think have gone past their style or are going to quickly go out of style and that you should be watchful of. The first trend I want to talk about is the cat eye brow lift. This trend, again, was popularized by Bella Hadid, models and A-list celebrities, where you get a little bit of a lift of this outer brow. This can be done with just a little bit of Botox in the right position to help lift that outer brow and give you that kind of swept up cat eye appearance. As that began gaining popularity, a lot of surgeons and practitioners said, well, we can make this permanent by just doing it surgically, and they remove either some skin directly, or they can even use something called an endotine, which is basically a thread with a hook on it to help anchor and pull that up from underneath the skin. These surgical enhancements, in my opinion, are just too much. A, it's an unnatural look. B, it's extremely difficult to correct if you decide after the surgical procedure you want it back down. And so for me, if you like that swept up look and a little bit of swoop to the brow, just do it with a little bit of Botox. So surgical treatments for that, in my opinion, not a great trend. Second one for me is a little bit controversial, buttock implants. I have never been a fan of buttock implants. I have some colleagues who use a lot of buttock implants and like them, and I don't think that there's anything wrong with that. For me though, I have never seen that the reward outweighs the risk. It's a foreign object that you're putting in your body. It's also in an area that is constantly under pressure and tension when you're sitting on it all day long. And so it's very common to have these buttock implants flip or become malpositioned, either out from under the muscle or over the muscle, and they can look weird. They can often get infected, requiring an expensive and painful surgery to remove and then clean out any infection. So for me, I do a lot of BBLs, which is called a Brazilian butt lift. And what that entails is liposuction and then fat grafting to the buttock. Very rarely are we doing big Brazilian butt lifts anymore. Every now and then I have somebody who wants a lot of volume, but mostly now we're refining this. We're using it to help create a more feminine figure. We're using it to fill in some hip dips and just give a little bit more volume and lift, not these big, gigantic transformations. So for me, buttock implants, not great. The last one that I'll talk about here is one that came into vogue for a little bit. It was a flash in the pan and then it quickly went away. This is called QWO, Q-W-O. You don't really see it much used anymore because of the complications around it. This was an enzyme that was injected into the buttock and the back of the thighs to help dissolve some of the fibrous bands associated with cellulite. So it was a cellulite treatment. Everybody was really excited about it because Kybella, which dissolves fat, had grown in popularity, and now we had QWO, which was going to help improve cellulite. But there were significant complications around it, bruising and swelling that was way more than what was anticipated. It also didn't directly treat the cellulite as we thought it would. And so while there was some improvement, it wasn't as controlled as we wanted it to be. And there was also some skin staining, what we call hemosiderin staining, that left kind of a blotchy look to the skin. So your cellulite might have been a little bit better, but you now had this permanently stained skin. And so we don't use that anymore. That's one of the few products that I have jumped on early, and I'm typically very, very slow to jump on a new product, a new device, a new treatment. I wanna give it years in the market to know that it's safe, to know that patients have good, reliable outcomes before using the product. So it's actually kind of a regret for me that we jumped on it so early because I think it didn't really work or last. Those are my trends that I think are going out of style or have already gone out of style. One more we can talk about. Thread lifts have gained a lot of traction over the last 10 years or so. They are a dissolvable suture with barbs that can be placed in different areas of the face to help pull and hold the skin up and tighter. This takes a very skilled injector or provider to give a good result. And again, these are temporary because the threads themselves are a dissolving suture. They can be very pricey. So for me, the cost really never seemed worth it. I mean, you're paying upwards of $3,000 to $4,000 for a lift that would be gone on within 3 months. So again, I think there are better procedures to give you similar results. Okay, so just to recap, some trends might be extremely popular. They might be talked about significantly on social media, but you have to understand that a lot of these things are trends and they oftentimes don't have quite the staying power as tried and true surgical treatments or other treatments that are available. And so I am very slow to adopt new trends because I want to know that they're going to be the most beneficial for you. In my opinion, plastic surgery should provide natural results. It should help improve your confidence, and jumping on the latest and greatest trend does not necessarily provide that.